speaking today with Dr. Rachel Levine, Assistant Secretary for Health at the U.S. Department of Health and Human Services, the first openly transgender person to be confirmed by the Senate. Dr. Levine previously served as the state of Pennsylvania's Secretary of Health, and before that, Physician General.
Dr. Levine was professor of pediatrics and psychiatry at Penn State College of Medicine, chief of the Division of Adolescent Medicine and Eating Disorders at Penn State Hershey Medical Center. Dr. Levine, we welcome you today to Conversations on Healthcare.
Thank you so much. It's a pleasure to be here.
Oh, it's great to have you. And you know, your personal story really informs your mission at HHS. And you've joined the agency at what I'd say is really concerning time, as there's a record number of anti-trans bills that have been making their way through state houses, although there is some good news that the Supreme Court just decided not to take up a challenge in one case involving trans youth choice of school bathrooms. And I'm wondering if you could talk about the dangerous level. I think you've called this some draconian measures that are happening at a number of state houses, and how they could impact health equity, health outcomes for the LGBTQ community, especially for youth populations.
Well, thank you for that question. I do feel that these bills are draconian. I think that the genesis of a lot of this legislation, unfortunately, is political, and that it's being used as a potential wedge issue in the next election. But what you have to remember is that this is directly impacting the health and well-being of transgender youth. Transgender youth are very vulnerable and are at risk of harassment and bullying. And so it is really particularly important for us to advocate for transgender youth. And these laws prohibiting their participation in activities and sports, and the most egregious in terms of preventing their access to gender-affirming medical care, really are going to harm transgender youth.
Well, Dr. Levine, against this backdrop, we have the pandemic, no surprise to anyone here, but you've advocated for a long time for a more integrated approach to child and adolescent health, and that we have certainly seen come front and center in terms of a need during the pandemic, as we've seen what a terrible toll it's taken on the mental health of children and adolescents. In the community health center world that we're part of, this integration has always been kind of the norm, not the exception, but not so much around the country or as a standard of practice. How is HHS going to address the crisis of child and adolescent behavioral health needs in the country going forward? And what models do you think are going to be most effective?
Well, you're correct. We are very concerned about the mental health challenges that we were going to see during the COVID-19 pandemic and as we eventually come out of the COVID-19 pandemic. And this is particularly true for our young people. As you mentioned, I'm a pediatrician and adolescent medicine subspecialist, and adolescent mental health concerns have been really part of my career through academic medicine and into public health. So what we're going to be doing is actually through the Secretary's Behavioral Health Coordinating Council. So Secretary Becerra is very concerned about these issues, and he has brought back a cross-cutting council, which will work with collaboration with all of our different offices throughout HHS. Actually, the first meeting of the Coordinating Council is tomorrow with the Secretary. One of the specific subcommittees and priorities of this council is child and adolescent mental health. And so we're going to be looking at that from many different perspectives. You know, COVID-19 has been such a challenge for young people, and you can think of it as almost, being a generational trauma for young people with the challenges that they have faced. And so we're going to be looking and working with experts across the country and across HHS on how we collect data about that issue, and then how we intervene and help young people struggling with their mental health concerns.
Well, I think, as you said, the pandemic has really laid bare the flaws within our American health system and how they've disproportionately impacted not just the LGBT community, but vulnerable populations across the board. And I know you're going to be participating in a panel this week on how community health centers can help develop protocols that are vital to serving these populations. And wonder if you could talk about some of the more important initiatives being advanced under the Biden administration and Secretary Becerra aimed at addressing health inequalities and the role that community health centers can play in this work all across the country.
Well, you are correct. Health equity is an absolute priority of President Biden and the administration, as well as a priority of Secretary Becerra. We also have another coordinating council, the Health Disparities Council, of which I'm very pleased to be one of the co-chairs. And we're going to be looking at the impact of COVID-19, as well as many different other health equity issues for vulnerable populations. I mean, that includes the African American community, that includes the Latinx community. It also includes the American Indian, Native Alaskan community, and you talked about the issues in terms of the LGBTQ plus community. I mean, the pandemic has impacted these vulnerable communities more than others, and this really underscores the profound disparities in health that we see in our nation. So we're going to be looking to make health equity a cross-cutting issue in everything that we're doing, and of course, HRSA will be right at the table, and we'll be looking at the way that community health centers can serve to promote health equity itself, and the way that we can, and the way that they really do serve all communities, particularly vulnerable communities. Mm-hmm. HRSA really is the agency that outside of public health, people don't know much about, mm-hmm. but it is a very, very powerful agency in terms of its impact on many of these issues, including health equity. And our community health centers are really a gem of our healthcare system.
Well, thank you for that. And I want to say we really appreciate the work of HRSA and have for many years in moving the agenda forward. And I also really appreciate your big picture focus on health equity. And then I come right back down to dealing with the pandemic again, if I can. So maybe just another question, if we can. We're all worried, sure, obviously, about the rise of the Delta variant. Mm-hmm. We're so proud of the great work that's been done around vaccines in this country. We're so worried about that last big group of people that haven't gotten vaccinated yet. And now we have the FDA with the warning about possible cardiac side effects among young people, though I understand from what I read anyway, more transient than anything permanent. But what are the big concerns at HHS as you all come together every day to talk about latest vaccine developments, the rise of the Delta variant spread? What are you seeing and what are you saying to people about what needs to happen next?
Sure. Well, under the president's leadership, we have made so much progress in terms of our vaccination effort. 87% of all seniors have received getting at least one shot. 75% of individuals over 40 and 70% of individuals over 30. And we're thinking that that's going to be 27% by within a week or so. 27-year-olds, 27 and above, having 70%. But we are having challenges with younger people. We're having challenges with teens, and particular challenges with young people 18 to 26, and who might be somewhat complacent that they will not suffer the negative effects of COVID-19. Especially in light of the Delta variant that is incorrect. The Delta variant is increasing in the United States. Approximately 20% of the new cases that we're seeing across the US are the Delta variant. It's more in some communities than others. The Delta variant has been shown to be more contagious, mm-hmm. more transmissible than the previous variants, and there is evidence that it can be more virulent, meaning lead to more severe disease, more hospitalizations, and possibly more deaths. And it will really impact any unvaccinated community, whether that's a geographic community or an age group. And so we are seeing more younger people who have gotten ill and have gotten hospitalized. So it leads to how much work we even now will have more to do about getting these vaccinations out. The message is that these vaccines are safe. Mm-hmm. These vaccines are effective, and they're more important than ever right now because of this Delta variant. Now, the issue in terms of the heart impacts really is very limited. The data from the CDC and that was reviewed by the Advisory Committee on Immunization Practice shows that if you look at a million doses of the vaccine, there are maybe 20, 30, 50 young people who might get a very, very mild and transient inflammation of the heart or myocarditis and that will go away either with no treatment or limited treatment within a short period of time. That's compared to hundreds and hundreds of young people out of a million that might contract COVID-19, several hundred that might be hospitalized, and a few that could even theoretically pass away. So the data is very clear, is that the benefits of the COVID-19 vaccine, the benefit of our safe and effective vaccines significantly outweigh any potential side effects. And a group of medical and public health stakeholder groups came together last Wednesday, after the advisory committee report, all saying and all agreeing with what we've been saying, is that the benefits of these vaccines outweigh the risks. So the bottom line is that our vaccines are safe, our vaccines are effective, and in the face of the Delta variant, they are more important than ever. So really, this is a call to action for people to get their vaccinations so we can stop the spread of this dangerous variant of COVID-19.
We're speaking today with Dr. Rachel Levine, Assistant Secretary for Health at the Department of Health and Human Services, the first openly transgender person to be confirmed by the United States Senate. First of all, I want to thank you for that clarity. I think people need facts about the science behind this. I think there's, and not blaming or shaming anybody, but just focusing on the facts that's so important. I want to go back to the pandemic. I think there's probably the only silver lining for some of us was the advent of telehealth, or the promotion of telehealth across the pandemic. Many of us have been waiting for it for a long time, and it really allowed many of us to build very robust systems and reaching to vulnerable populations who hadn't been reached before. I saw that Secretary Becerra was featured in a Washington Post interview recently, and where he was advocating and supporting the work that's going on in telehealth. And I wonder if you could share with us and maybe shape up how HHS is going to provide ongoing support for the expansion of telehealth. I know the Secretary, as well as you, are very concerned about rural populations and really, at least in this part of the country, and I think nationally as well, the ability to do this by audio as well as audio and video, I think is really level sets the opportunities for everyone to engage. So tell us about the types of investments that might be needed, and how do you see the potential payoff for the expansion of telehealth?
Well, thank you for that question. COVID-19 has really helped usher in a new era in terms of telehealth and telemedicine. And this is a priority of the Secretary and a priority of my office. And we will work really across HHS on continuing these advances in telehealth systems. And so the federal government did put in many measures in place during COVID-19 to make telehealth easier. This does include HIPAA flexibility for telehealth technology, Medicare and Medicaid policies. So we're working with CMS on that in terms of waivers and regulatory changes, making it easier for providers to deliver telehealth services to Medicare and Medicaid patients and to get reimbursed for that. Providers can deliver telehealth services across state lines. So there were telehealth licensing requirements and interstate compacts that were waived. Prescribing controlled substances, including the prescription of medication for opioid use disorder, such as Suboxone, through telehealth. I mentioned telehealth reimbursement. So there are a lot of these measures. We're going to have a department-wide group under the Secretary's leadership looking at which are the priority measures which absolutely have to remain in place. Another model that I wanted to kind of emphasize is a model that we used in Pennsylvania. It was first developed in New Mexico, and that is Project ECHO. Project ECHO was developed by the University of New Mexico, and it's a guided practice model which really helps rural areas that are serving underserved communities, remote areas of Pennsylvania or remote areas of New Mexico and other states. It's a hub and spokes knowledge sharing approach where content experts, expert teams, for example, the University of New Mexico when it was first developed, but in Pennsylvania at Penn State Health and the Penn State College of Medicine, led virtual clinics. They would talk to rural providers about delivering best in practice care. We use this in Pennsylvania first in terms of opioid treatment and medication for opioid use disorder and the prescription of medications such as Suboxone. But I know Penn State now is using it for COVID-19 evaluation and treatment and many, many other conditions. So it really is such an innovative way to use telehealth. But I do want to emphasize something that you mentioned is that we have to be careful of the healthcare disparities in terms of telehealth. Not everyone in our country, especially in rural areas, have access to broadband. Not everybody has great computers like we're using right now, with Zoom and other technologies to be able to do these type of visits. So auditory only telehealth is a very important aspect, which is a priority as well.
Margaret, the doctor just mentioned our good friend Sanjeev Arora,
Right.
who we worship here.
Absolutely, and we couldn't agree more. When people think about telehealth, thinking about that component of telehealth, about how we move the needle forward for everybody is super important. So thank you so much for calling that out. In this period of time when we've noted so many milestones, one of the milestones that we noted recently here was the 40th anniversary of the AIDS epidemic, and we were honored to have Dr. Fauci back on the show with us. And it was very hopeful when he suggested, as we were talking about COVID and the vaccine, that the remarkable science and the years that went into developing that vaccine might also pave the way for a potential vaccine for HIV. And I think he said within a decade, which kind of took my breath away after 40 years. Can you talk about our efforts here in the United States and globally to address the ongoing epidemic of AIDS and perhaps to look forward to a day when we might end this epidemic?
Well, thank you for that question. I have taken the opportunity marking the 40th anniversary of the HIV epidemic to reflect on the changes that we've seen. So, I started my residency program, my internship in New York City in 1983 at Mount Sinai Hospital. Now I was in pediatrics, so I saw a different side of the HIV/AIDS epidemic. And what I saw primarily were infants that were impacted because they got HIV from their mother, who might have had HIV from a number of different causes. And those infants passed away. And then frequently their mother and potentially their father passed away. And the HIV epidemic was devastating. I also saw teens who had HIV from a number of different reasons, and they passed away in the 80s. And so we have made so much progress on so many fronts. HIV testing now is easy, it's fast, it's safe, it's confidential, it's much more accessible, either at home or in another location. And there are 1.2 million people approximately living with HIV and take their HIV medication, maybe one pill a day, where it's a chronic illness, but they are living long, healthy lives. And U equals U. Undetectable means untransmissible. And they have essentially no risk of transmitting HIV to others. But we have a long way to go because 1 in 8 still don't know they have HIV. So they're not able to access these life-saving medications and these needed services. So to really end the HIV epidemic, and we have an end the HIV epidemic program and priority, we really have to support not only those living with HIV that we know of and we're supporting with medication, but support the people who have undiagnosed HIV. We have to support them in terms of access to testing and to treatment services. This is a strong health equity issue. But we also have to continue to expand pre-exposure prophylaxis, PrEP. I mean, we have a once-a-day medicine that can prevent someone from getting HIV. When I was an intern in 1983, that would have seemed like a miracle. Right. And we have to continue to expand access to PrEP and to PEP, post-exposure prophylaxis, syringe service programs, periodic HIV testing. So, ending the HIV epidemic is a core strategy for the Office of the Assistant Secretary of Health, as well as across HHS and the CDC. We seek to reduce new HIV infections by 90% by 2030. We talked about community health centers. They are a key component to this effort. In the 57 EHE jurisdictions, our health centers are an absolute key aspect of that. And these health centers have prescribed PrEP to 63,000 patients. Just this past March, HRSA announced nearly $99 million in funding through HRSA's Ryan White HIV/AIDS program to expand access to HIV care, treatment, medication, and essential support services. So, the Biden-Harris administrations remains committed to this funding, as well as, for example, the Ready, Set, PrEP program within OASH. So these are priorities for the secretary, for myself, and across the administration.
Oh, that's great.
Thank you.
Not only important goals, but good news in terms of the work that's being done all across the country. We've witnessed some disturbing trends in the wake of recent events, and we've seen some true assaults on science and scientists like Dr. Fauci and yourself. And thank you for being a clarion voice and standing tall and speaking truth and science to power. And yet we see over the last number of years that trust is eroded in some of our really revered organizations like the CDC and HHS. And I'm wondering, how do we address this misinformation campaigns that are really undermining the credible work that's being done by these agencies in advancing public health and trying to save lives, especially during this particular crisis that we're in? Where do you think we go from here?
Well, you are correct. I mean, COVID-19 has been much more challenging in the United States than it was in Pennsylvania, where I was the Secretary of Health, because it has been politicized. And many aspects of our response to COVID-19, such as mask wearing, such as the vaccinations, have been politicized. And that makes it much more difficult. These are public health issues. They're not political issues. And so we need to keep politics out of public health and out of medical practice. And we need to continue to emphasize proven scientific methods, both for medicine and for public health. As developed the scientific methods that have developed these amazingly effective vaccines that we have, that we're working to distribute and to administer. So at HHS, Dr. Fauci, myself, Dr. Walensky, Dr. Collins, Dr. Murthy, our great Surgeon General, we're going to work to get the best information out there to as many people as we possibly can, and stick to the science, to educate people about COVID-19 and other medical and public health issues. This is a particular priority of the Surgeon General in terms of his work to counter misinformation that the public gets through social media and other ways. So, at its heart, I'm a positive and optimistic person. I think that we can, and I firmly believe that we will learn the lessons from COVID-19, and we will build back a healthier future for all of us and to heal as a nation.
Can I slip in one last question?
Go ahead.
Just
Sure.
For all those parents out there who have 2 to 12-year-olds, when do you think we'll hear the results of the clinical trials that are going out and that those vaccines might be available for that age group?
Well, first, it's important to emphasize, and thank you for that question, that we have a safe and effective vaccine for 12 through 17-year-olds.
Yes.
So right now, the Pfizer vaccine has the authorization from the FDA for teenagers 12 through 17. So I would certainly encourage all families, all parents, to have their teens vaccinated, especially in the face of the new Delta variant. So those clinical trials for younger children are going on right now for the Pfizer vaccine and the Moderna vaccine. I can't put a date on science, so I can't tell you when those clinical trials will be completed, and they'll be able to present their data to the FDA for consideration, and then to the CDC advisory committee for their consideration. I think that hopefully by the end of 2021, it could be towards the beginning of 2022. But those studies are going on right now, and we'll remain positive and optimistic that they will show the safety and the effectiveness even for younger children, and we can start that vaccination program as well. But we will await the science and the results of the clinical trials.
Great.
Science doesn't have a date. I'll have to remember that one soon. We've been speaking today with Dr. Rachel Levine, Assistant Secretary for Health at the U.S. Department of Health and Human Services. Learn more about her work by going to hhs.gov/ASH or follow her on Twitter at HHS_ASH. Dr. Levine, we want to thank you for your innovations, for your efforts advancing child and adolescent health and mental health, and for trailblazing a way forward for equity and inclusion for the LGBTQ community. And thank you so much for joining us today on Conversations on Healthcare.
Thank you. It was a pleasure to be here.
Yeah, we really appreciate it. Continue to follow your work, and
Absolutely.
thank you for your leadership.